Starting off with COVID-19, Harris County raised its COVID threat level to the highest level, red. Health leaders say this pandemic is far from over and things will only get even worse in the coming weeks.
This level signifies severe and uncontrolled spread of COVID-19 in Harris County. That means outbreaks are present and worsening, and our public health capacity is strained or exceeded.
Now, health leaders are urging you to steer clear from hospitals and emergency rooms unless you have a life-threatening emergency.
Now, this is alarming for parents because the start of school is just days away. Several districts tell us their hands are tied when it comes to the elevated threat level, as well as the guidance from the governor and the Texas Education Agency.
Michelle Choi joins us live. She covered the original guidelines the TEA put out for COVID-19 last year. And Michelle, a lot of parents are upset about these new guidelines.
Oh yeah, Kim and Steph, parents are fired up. You know, the TEA released their new guidelines for schools on how to handle positive COVID-19 cases yesterday. And well, in a nutshell, parents say these guidelines are too loose and they don't do enough to protect their children. Here are some of the big takeaways and what they mean for your family. Take a look. First, the TEA is now allowing for limited remote instruction if students are sent home. Second, masks. The TEA says schools cannot require students or staff to mask up, but they can allow them to wear masks if they choose to do so. Third, schools are not required to inform parents about positive cases, but they must report it to the state health department. Fourth, schools don't have to conduct contact tracing. The TEA says they came to that decision based on last year's data, which showed there was very low transmission rates in classroom settings. Next, if a school does contact trace, parents can still choose to send a child to school, even if they are close contact of an infected student, but they are encouraged to keep students at home during a recommended 14-day stay-at-home period. And finally, schools must exclude students who test positive from attending in-person learning, and parents need to make sure they do not send their child to school if they are confirmed positive or have symptoms. Now, if you'd like to have a closer look, we have the TEA's full health guidance for the upcoming school year posted on our website at khou.com.
Yeah,
Steph?
Michelle Choi, thank you so much. Much different guidance from this time last year, so it's definitely worth a second look. Meanwhile, HISD's superintendent says the school board will vote on setting up stronger safety measures next week.
And as superintendent, what I plan to do is bring back a mask mandate for ratification in our next board meeting.
That mandate would go against Governor Abbott's executive order, but other school districts across the state are considering similar options. Austin is even allowing optional virtual learning for students 12 and under who can't get the vaccine.
Now let's get to some of your coronavirus headlines this morning. Counting down from number 3, the first big Super Saturday vaccination drive gets underway tomorrow. Nearly a dozen local school districts are participating to get the shots to eligible students and families. We have all of that information listed for you on khou.com, bringing us down to number 2. A new CDC report shows a low number of adverse effects from the COVID-19 vaccine in kids. Of the nearly 9 million 12 to 17-year-olds who got the shot, there were less than 10,000 reports of issues. Most were related to dizziness and headaches, bringing us to number 1. The FDA is aiming to have a plan in place for COVID-19 booster shots by early September. The daily pace of vaccinations is at the highest level in 7 weeks. Right now, roughly half the eligible U.S. population is fully vaccinated. And all this talk about booster shots comes as our hospitals are filling up, Steph.
That's right. In fact, hospitals are quickly reaching their breaking point across Texas.
I'm Anayeli Ruiz. Doctors here in the Texas Medical Center are concerned because COVID cases are rising and many emergency rooms are already stretched thin. Just yesterday, the Houston Health Department announced they'd seen an increase never before seen. The COVID in our wastewater is 320% higher than last July. They tell us this predicts where we'll be in weeks in advance. That's why many hospitals are getting prepared for even worse conditions. Houston Methodist says they're opening areas they'd closed and putting them into service again.
We would encourage you not to come to the emergency room unless you absolutely need to.